Hey guys, my name is Mavi and I've spent the last 14 years in the plastic surgery and beauty industry, working alongside some of the best plastic surgeons in the country. Now I don't work for anybody, so I have unbiased opinions about hundreds of surgeons from across the world, and I can help you achieve the body of your dreams. Hey guys, do I have the show for you today? I'm so excited to have the OC's female plastic surgeon, Dr. Shabnam Ghazizadeh, on the show today, and we're going to talk all about beauty trends in 2024. Welcome to the show, Dr. Ghazizadeh.
Thank you so much. I'm so excited to be here.
Thank you. Girl, I was binging your TikTok, your Instagram before we came on, and you are killing it. I'm so proud. I'm so happy to see a female plastic surgeon rocking it in a predominantly male field.
Thank you. I mean, I really appreciate it. I love Instagram for that reason. I feel like I get to showcase kind of what I'm passionate about and reach out to my patients to let them get to know me a little bit because you're right, it is a male dominated field, especially here in Newport Beach. Like the only female plastic surgeon here. So it's an exciting time and we're growing and we're getting into the space. So it's really lovely to see.
I love to see it. So one of your videos that caught my eye was your video about the beauty trends in 2024, and I'd love for you to share with us what you're seeing and what you expect to come in the future.
So I think 2024, like when I'm looking at celebrities, I'm seeing kind of how trends in terms of natural beauty are going. I think really having a clean aesthetic is becoming huge. I think really beautiful skin quality, doing the things that are just like small natural tucks. I think not those drastic, huge transformations that, sometimes don't look natural, or those are just not really in. Like those big lips that look just like really too much. They don't fit your face. I think really fitting the proportions of your face and making everything look really elegant and delicate is really where things are going. And so I think doing things to your skin, really rejuvenating your skin. I think the younger generation is doing a great job of getting into that, and then the small tucks and as well as the big tucks, but blepharoplasty, lip lift surgery to fix the proportions of things, and then facelifts and neck lifts, and doing those in a natural way is going to be really big.
I totally agree. I've seen a big reduction in overfilling. I've talked about it on the show a lot about how you can get a little distorted in your mind when you're looking in the mirror and you want more, 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 and before you know it, you don't even look like yourself anymore. And
Oh,
I'm hoping you're seeing that trend go down.
yes. Yes. And that's how I counsel my patients. It's not about more is more. It's about what's right for your face. And, realistic expectations about what is beautiful and what you can look like your best version of yourself. You're not going to look like anyone else. We can't implant somebody else's cheeks on you. You shouldn't want that for your facial frame. So everything has to look proportionate and really nice on you, and just trying to find that natural balance.
Absolutely. So, one of the things that I really loved on your page was the lip lift explanation of how you take your measurements and how you decide. And for me, I've been getting lip filler forever. Forever. Let me think. I'm 34 and I had my first lip filler when I was like 21. So it's been a while. And
Yeah.
now I'm getting to the point where when I get my lips injected, I've had my injector say I can feel the scar tissue in there, which I'm kind of like, good. So that means they're never going to go back to the way they were all the way originally. But I'm also thinking, like, okay, maybe it's time for me to start exploring the idea of getting a lip lift instead of continuing to get fillers. Give me an idea of what you think about that instead of doing so much lip filler, doing a lip lift.
I think the way I think about it, it's not one or the other. I think it's you have to be the right candidate. I don't think that somebody who's having lip filler and just wants to have something more permanent is automatically going to be a lip lift candidate. I think that's the wrong way to think about it. And I don't want the public to start thinking that, because then you're definitely going to find a surgeon who's going to do it. And if you're not the right candidate, you're going to get a permanent scar in the middle of your face and not that much benefit, and potentially look pretty unnatural. You don't want your lip and your nose to be connected. That's not the goal of a lip lift. So
No. No, no.
So I think really still looking at people and making sure they're a candidate before that, not just having filler fatigue and like looking for another option. Filler definitely still has its place in lip augmentation, but I think that there's limitations to that. And seeing in the right patient who just keeps getting vial after vial after vial, and it's starting to migrate and they're just not getting the result they want, like should they have gotten a lip lift first and reset the proportions, made their face look more youthful, then come in with some volume if they need it or if they want it later. That's kind of the way I like to think about it. And there's several things that I look at when I'm looking to see if someone's a candidate.
Okay, the reason why I thought for me, and you guys, I'm talking about for myself, because I had a lip lift with Botox and I really
Mhm.
liked how it looked. And I was like, you know what? With the lip lift with Botox, I really don't worry about having more fullness. I think I like the fullness now. It's just having that little tiny little lift.
Yeah, the lip flip. Lip flip is great. I often tell my patients, like, if you haven't tried this, just try it. Like, maybe it makes you a little bit, using a straw is a little weird. A couple letters are a little weird for a little while, but that kind of goes away by week one. And, I have it on board right now. So I think that it adds a little bit of fullness for the right patient. But I'm not a lip lift candidate, but I do like a lip flip. So right now, I have a good lip flip because my lip is not like thinning out when I smile, but that distance there's nowhere else I can add. So I can't, you could get a lip flip and not be a lip lift candidate either. So all three of these things are options, but you have to go to a surgeon who knows what they're talking about when they are offering these to you.
Oh, 100%. We can definitely go into that a little bit later, but for now, tell us who is a good candidate for a lip lift.
So lip lift, things that I look at are one, like the whole facial skeleton, the whole proportions of the entire face, and then also like their dentition. So someone who has like a prominent maxilla, their teeth are a little bit more anterior there, they need that length to close their mouth. So you don't want to make it so someone can't close their mouth or you're having functional problems. Also really long teeth. You don't want to get this like bunny look like this. So I'm looking at those things and then their whole facial proportions. This area is 1/3, this area is 1/3, this area is 1/3. So you want to look at the whole face when you're deciding. So once you've kind of gotten that sense and they're still a candidate in that way, like they don't have super long teeth or they don't have like a bite problem, then I'm looking at the length of the lip itself, how much tooth show they have. So if you have a really long lip, I'd say really long would be like greater than 2 centimeters. That's pretty, for my aging female patients that I see a lot, that's actually not that uncommon. But the younger patients are closer to about 17 millimeters, I'd say. And that still is a candidate in the right person. And then tooth show. So it's really youthful to have some tooth show. And that can vary anywhere from 0 in like an aging face patient to more like 4 or 6 millimeters of tooth show when you're just like kind of at rest with your mouth parted like this. So I have like some good tooth show when I'm not doing anything. You have a little bit less than I do. And on everyone's face is a little bit different depending on how long your teeth are, how long your lip is, like all those things factor in. So those are the kind of the things that I'm looking at. So the length, how much tooth show you have, the fullness of the lip itself, so how thin it is. And I do have patients dissolve their filler sometimes so I can get a good measurement and idea of whether or not they're a good candidate.
Wonderful. So I've always wondered about instead of continuing to get lip filler, maybe do fat grafting. What do you think about fat grafting to the lip?
So there's different options, and I think that like they've all had their historic place. Like back in the day was what, the silicone implant,
Mm-hmm.
and those are all being removed now because it's just weighs down. It doesn't give you a nice shape, and it causes like really unnatural looking lips or extrusion. Then there was fascia. So when at the same time of doing a facelift, you can take some of the fascia from the SMAS and put it in the lip and kind of snake it across the top, and that's not a bad option. And then fat grafting is always an option in almost any area of the face. But the problem with fat grafting is it's kind of a little lumpy. So the fat, even though we get it like really processed down to a point where it's like thin enough to inject through a cannula or a needle, which is what we do with all the fat grafting all over the face, the take rate is not 100%. So some of it's going to dissolve, some of it's not. This doesn't have a lot of room for error, basically. Like, you know, your layer that you're injecting is right above the muscle, right below the mucosa. And that's a thin space. So if you get any lumpies, and people have probably gotten lumpies when they do a filler, it's not going to go away with fat, and you can't dissolve it either. So you're kind of stuck. So when we do fat grafting in the face, in the cheeks, and like the mid face, and those areas that we do, like the temples, we do it in a layer where it's deep enough that there's enough overlying tissue to camouflage any potential lumpies, because you expect some amount, right? There's, you know, studies that go anywhere from like 60% to like 80% of like take rate, and can be less, could be more. So you don't ever get 100% like what I put in here is going to be what you're going to have. So I think that's not that great of an option for the lips. It would be nice, but I don't think that that is the number one thing
Dang.
for lip volume.
Dang. So I'm
Yeah.
gonna have to keep now I'm thinking, okay, my options are narrowing down.
Yeah.
Because I want to keep them full, but I'm starting to think, okay, what else can I do instead of continuing to get lip filler? But I might have to keep thinking about it.
Shift in the right patient on you, like, you know, it's definitely something to consider. I think the thing that people need to weigh is how much benefit for that incision. That incision's in the middle of your face. If you go to the wrong
Yeah.
person, it can be even more prominent. So making sure they're using the technique that's going to make the thinnest, most camouflage incision possible.
Right. You always have to outweigh the risks and the benefit and see if it's the right choice for you. So I saw on your Instagram that one of your other favorite procedures to do is rhinoplasties. And girl, everybody asks me about rhinoplasties. So tell me about how you came into deciding that you wanted to focus on facial plastic surgery, going down that route. Which procedure is your favorite to do on the face?
So I train primarily as a head and neck surgeon. So I'm board certified by the Head and Neck Society, American Academy of Otolaryngology. And while I was in that training, you know, we do everything: surgical oncology, you know, airway specialists, ear surgery, sinus surgery. I really liked the aesthetics aspect, and I really liked, you know, putting the face back together after trauma, or even not after trauma, with our cosmetic patients, trying to help them get to that place that they want to be. They feel the most confident about their look. So, and then during my fellowship, I did a lot of rhinoplasties, and that is definitely the hardest surgery, I would say, for any surgeon, you know, general plastics or head and neck surgery, because it's 3D. It's, you know, you're working with so many different materials like soft tissue, cartilage, bone, grafting things. So, and there's a lot of decision fatigue in rhinoplasty. Like every step is brand new, unique to that case, unique to that patient, versus lots of other surgeries that we do. You do the same steps after each other. So you don't have to make a decision every single move. So I think that's what makes rhinoplasty so hard. And I'm an engineering by background. I did biomedical engineering. And I think that that like kind of engineering part of like building a nose, building a 3D structure, and trying to put something together that's like complex the whole way through from the beginning to the end of the surgery. I really enjoy that. So I think rhinoplasty, I would say, is my favorite.
Ooh, I love to hear that. So, what kind do you, when you have a consultation for rhinoplasties, tell me, what do you see them asking the most, and how do you decide if somebody is a good candidate for a rhinoplasty? I'm remembering somebody that was in my DMs over the last couple of weeks who was like, I'm looking for a surgeon for a rhinoplasty, but I only want a little bit. And my nose is already small. It's just a small little fix. I'm like, girl, just because your nose is small and it's a small fix doesn't mean it's a different than any other rhinoplasty. We have to find you a really good rhinoplasty surgeon. So tell me a little bit about that.
I think that's great that you tell them that, because I think the smaller the change, the harder the rhinoplasty. There's a lot to control in that procedure. And I tell my patients, like, maybe 85% of your result is what I do in the operating room. The other part is healing, you know, scar tissue formation, dissolving this dissolvable sutures I put in and creating scar tissue that supports what I did. There's no 100% with rhinoplasty. And I think that's the hard part, to have patients kind of like understand that expectation and expectation management. Because I think the ones that come in, they're like, this 1 millimeter is bothering me. It's like, but by undergoing closed or open rhinoplasty, you're disrupting ligaments and creating scar tissue, and doing things that we can't control or know exactly how that's going to heal. To fix the 1 millimeter, you can make another 1 millimeter problem somewhere else. So the best rhinoplasty patients are the ones where the problem and expectations align, and the surgeon sees those, can fix those, has the confidence to fix those. So there's a lot of, I think, counseling and expectation management with rhinoplasty, and it seems a lot easier than it is.
For sure. But you know what? I like to talk with my plastic surgeons, and in their podcast prep forms, I always ask them, what's your favorite procedure? And so many of them say rhinoplasty, but I don't do them. I don't work on them.
Really? I can't
They
believe that.
feel like they don't have enough. I feel like it's one of those things that as a plastic surgeon, they either get a lot of them or they don't really get a lot of them. They get more body surgery. But most of them say, at first, when I first started, I really wanted to focus on rhinoplasty, but because my practice grew in a different direction, I don't get to do them that often. So I hear that from a lot of surgeons, that they love the complexity of the rhinoplasty procedures, and really just facial procedures and all.
Yeah. Yeah. I mean, your practice kind of has a mind of its own, I guess, the location, your referral patterns, the patients that you're seeing. And I can totally see how the further you get up from training and the less you feel like the expert, you want to send patients to the place where they can get the best results. So if you're not doing that often, you're not feeling that confident, maybe you send those out.
They do.
Luckily, I do a lot of rhinoplasties, so I get that volume that I need to feel up and continue to like keep my craft at the highest skill level that I can. But there's other procedures that maybe I don't, and those eventually will kind of like not be the thing that I focus on.
So on the face, I also see that you do a lot of deep plane facelifts and neck lifts. And we've had male surgeons on the show talk about how they do them and their approach to them. But I love my female surgeons. Y'all do so much. I don't want to say better, but I mean, I just love y'all more.
There are studies that actually show that we have better results. Have you seen that study?
Yes, I have.
Yeah.
Better results, less deaths. So tell me a little bit about your approach to facial rejuvenation when it comes to facelifts and neck lifts.
I think, again, patient selection, patient expectations is important because not everyone's going to have the same recovery. And I think we luckily here have, really have very smooth recoveries, and our patients do really well. But there are those patients who can have some of the bumps during the recovery process, and just being present and being able to be available to the patients and make sure they are taken care of during that time is really important. That's part of kind of what I work with my patients on. I think my philosophy is, keeping things natural, not over pulled, really minimizing the scar, but putting no tension on the skin and releasing the ligaments that are needed to reposition the face and really get those results. And that, takes a little bit longer in surgery, I'd say, than, just doing something fast and getting them out. And when you give them, it's going to take about 4 hours to do the surgery, they're like, oh, so long. But it's like, but it's not, because we're releasing the ligaments, we're going to that deep plane, we're getting everything repositioned. And we do our surgeries under twilight, which patients really appreciate, and they come here because that's a specialty of our practice here, is to do them without general anesthesia. And that's a result of being able to do it faster, doing a good job with the tumescent and lifting the skin in a way that I can get that done in a shorter amount of time.
Beautiful. So when you do your facial rejuvenation, are you putting them on a special skincare treatment after? Are you recommending any type of lasers or resurfacing treatments post-op?
I think before and after is really the best case scenario, because The way I think about like facial aging, it's like there's all these layers, that your every single small thing that you do is addressing one specific part of the aging process. And the deep plane facelift, the neck lift, you're addressing the muscles, the soft tissue, the facial skeleton, repositioning things. But even though you're pulling on the skin to some degree, you're decreasing some of that skin bunching and that skin laxity, you're not changing the quality of the skin, the texture of the skin, the hydration of the skin. And so that can still be aging you, even though your neckline is sharper. So I think that before and after surgery, and depending on the skin tone, during the surgery, we do CO2 for the patients who are good candidates for it. Thinking about skin quality is huge. And some patients have already done something like Profound, which is great for skin quality improvement and a little bit of skin tightening, or after the surgery, they would benefit from something like Profound or CO2, in addition to a great skincare regimen. So skincare, I love to talk to my patients about. I don't always get to it like I wish I did, but in the ideal world, patients would be already on a great skincare regimen. Their skin would be where they want it to be before they do a facelift. And if it's not after a facelift, definitely, because that's going to be the telltale sign afterwards. If you have this like aged, creepy, thin skin, but you have great proportions, your facelift's going to look more obvious than someone who has younger, buoyant, hydrated skin with a facelift. It's not going to be as like, contrasting.
So we haven't really talked too much about CO2 lasers on the show. So if you can give my audience a quick rundown on what it is, what they can expect as the result, and for the recovery.
So CO2 laser is like the powerhouse of resurfacing of the skin. And it's basically a fractionated laser. It's an ablative fractionated laser. So fractionated means that it is making small little micro injuries in one spot surrounded by normal healthy tissue, and then another spot surrounded by normal healthy tissue. It's not a complete resurfacing of all the skin. So it's just small little columns of thermal injury, and it basically ablates or removes that skin with heat injury, and then you slough off the rest of the skin. So you do the CO2 laser, totally customizable settings. Every CO2 laser machine, the power, the spacing, the dwell time, all these things are set by the surgeon. And so no two CO2 treatments are going to be the same. No one can do them exactly the same unless they're using the same machine, using the same settings. So your result depends on who's using the machine, who's using the device. And then after the procedure, you can expect some redness, kind of feels like a burn, like, a little sunburn. The redness, depending on the settings, can last, anywhere from like 2 weeks to a month to even 3 months, depending on the skin type and the settings. And then you just basically apply an emollient onto the skin, like an Aquaphor, or we use a special healing ointment while the skin is sloughing off, basically. So those little thermal injuries, you're just going to see a bunch of little coffee ground dark spots. And then with the emollient that you're just applying on, it slowly just starts to slough off. It's different than a chemical peel where your skin is actually peeling off. This is kind of just like they kind of roll up into a teeny little ball and they go away. And then your fresh new skin underneath there looks like a little sunburn until it, normalizes and just looks like baby skin, looks like a baby's bottom.
It does. It looks beautiful. So are most CO2 procedures a one and done, or is it a series?
I would say CO2 is pretty powerful, but it's never a one and done depending on what area you're treating and the skin quality that you're starting with. So especially like perioral lines in more aging face patients, they're deep, and the skin texture really needs some help. So in those areas in particular, you usually need one or more treatments, or patients with a lot of sun damage on their neck and their chest, or their hands. We do a lot of neck, chest, and hands, especially here in sunny California. Our patients have a lot of like pigmentation, texture, wrinkles, all those things that come with sun exposure. And you can't do those highest settings on the neck or the chest because the adnexal tissue underneath it doesn't have as much recovery power. So you can cause some serious damage if you're using the wrong setting in those areas compared to the face. So you do need to do, a couple treatments usually, and it really depends on the skin quality.
Absolutely. So if you're thinking about having a CO2 laser, because that does come up in my DMs quite often, you have to make sure to find a good provider. And you guys know that I love medical spas that are attached to plastic surgeons' offices, or they're right attached to a facial plastic surgeon or a dermatologist. so that there's more than just a standalone, spa with maybe a nurse or a nurse practitioner. Not that they can't do great work, but for me, when women come and ask me for recommendations on how to find a spa or how to find somebody to do it, I always like to say, please go to a spa that's a medical spa that's attached to a doctor's office. I feel like there's a lot more protection that way. The doctors are a lot more involved in trainings and training staff and being on hand. And there's a lot more checks and balances, I feel, when you go to a medical spa. What would you say if somebody's asking you, how do I find a CO2 laser provider?
Yeah, exactly how you said it. The provider, whatever devices they have, whatever they're comfortable with, and whatever their aesthetic is more important than the device. If you're searching for CO2, I think you're looking at it the wrong way. Like you should be looking for someone who can get the results you want with whatever device they have, and you trust them, you have a relationship, all those things. They can get you there with different devices. It doesn't have to be CO2. But if you go to someone, you're like shopping for just your device, you're going to get whoever provider with whatever settings. And that is the bigger thing. Choosing the wrong patient for the wrong device, the wrong skin type, the wrong skin color, you can cause all kinds of issues from these things. Like these aren't mild, like, I guess microneedling, the one size fits all. Like most people can get microneedling without a problem. Things like deeper chemical peel, CO2 laser, you can cause really bad problems. And so you should look for the providers who are safe, get the good results, trustworthy rather than device.
I agree with that. You guys know that I'm very big on building a relationship with your provider, with your surgeon specifically, because you're on a lifelong journey, right? You're not going to just have one procedure and that's it. You're never going to you don't care about how you look anymore and that's it. You're never going to come back. You're going to continue to come back to your surgeon for multiple things, maybe here, maybe there, skincare, lasers, all types of things will come up. So, building a good relationship with your provider is vital. The difficult part is for my girls who are in rural areas who are looking for providers and they can't really find them. So, for those girls are the ones that I'm really thinking, well, how can I guide you to the best way without so that you don't get hurt? Where I'm like, okay, there must be a good plastic surgeon by you or a good surgeon that has a medical spa attached, and they can probably find you or get you where you want to be.
Yeah, and we have patients who travel here, and I kind of like to build a partnership with injectors or other, medical providers in other states so that the patient has somewhere to go in-house. Like if they want to get their Botox or their injectable, like it's not really feasible for everyone to keep coming back to me for those kinds of things. Like they'll come here for the facelift, then they want to go home to wherever that is. And I love that I can find like a trusted injector or someone there that can help them with those things, while they're doing those until they come back for the next thing, which is like the blepharoplasty or the eyelid lift or. So yeah, there's a partnership, and you can still find good injectors and people to partner with your plastic surgeon. Even if you're out of town.
So before I let you go, Dr. G, I always like to ask my surgeons, if you were talking to your best friend or your mom and she's looking for a surgeon, what's one tip that you would give her?
Okay, so I think the thing, I think personality. Like I feel like, especially here, when I'm around a lot of male plastic surgeons and the patients that come to me, have either seen another opinion, seen another male plastic surgeon, and a lot of times they're coming to me, and after our consultation, they're like, this was really refreshing because I went to this other guy and I just felt intimidated. I felt uncomfortable, and I really trust you, or like you're really approachable, or like I think that those things really matter. And so using your spidey sense to just feel like, is this person gonna do what's best for me, be there for me during the recovery, or am I just another quote, So I think the personality fit is bigger than people know, even if they have these tremendous results and like you seeing all this stuff on Instagram, and you go and visit them and you kind of get an inkling of like, oh, this didn't really work for me personality wise. I would listen to that more than thinking, well, it's okay though, because I'm going to get the result I want, because they need to be there for you in that recovery. And it never goes as smoothly as you see on Instagram, I would just say. Those are the best case scenarios. We're trying to showcase, I notice people are trying to show a little bit rougher recoveries because that's also part of it. Some people have those and you can't even tell who it's going to be. But knowing that your surgeon is going to be there with you, available, give you their cell phone number, call you to check in, make sure you're doing okay emotionally, mentally, physically. I think that that's a little bit underrated and it should be paid attention to a little bit more.
I 100% agree. You hit the nail on the head with that. So, if you ladies want to go see Dr. G, how can they find you?
My Instagram is Dr_Ghazizadeh. And then my website is drghazizadeh.com. And I'd love to connect with any of your lovely patients and podcast listeners, so they can always DM me or call our office.
Wonderful. Thank you so much for coming on the show, Dr. Ghazizadeh. It was a pleasure meeting you, talking to you, getting to know your philosophies, and I can't wait to see how your practice continues to grow and your before and afters.
Thank you, Mavi. This was wonderful.
All right, you guys, I'll see y'all next week.